the
I
state
think you
officials and
answered my
say,
questions pretty well.
okay, and if the state doesn't react, they go to O'Brien and Schmolzerwitz. You see their ad on TV all the time. We sue nursing homes. They've collected millions, they claim, from nursing homes to keep them on the ball. Have you ever had them contact you?
No, I'm happy not.
All right.
Okay, thank you, caller. We're enjoying a few moments with Leslie Flexer. She is the case manager of one of our local nursing homes, a skilled nursing facility, and it is the, it used to be the Waters, but now it's the Absolute, which is a name of a vodka.
We know how to keep our residents happy.
Yeah, IV vodka, guys, can't go wrong. You do other things that a normal nursing home can't do. You give them oxygen. Are you permitted to do IVs?
We do IVs, we do IV antibiotics. We do a lot more than a fair amount of the other skilled nursing facilities do. We'll take on a more complex patient, and our nurses are just that well skilled at starting IVs, drawing blood, doing the, again, IV antibiotics, IVs. We're also the only skilled nursing facility that has a full-time nurse practitioner who is there for our patients, and should something go on, it used to be prior to her arrival, you'd have to call the doctor, who's usually busy with the patient in the office. You'd have to wait for the doctor to finish to call you back. The doctor couldn't leave right away, which makes sense if you have a busy office practice. So they would either have to, the patient would either have to wait a little bit, or they would send them to the emergency department to see what's going on. With our nurse practitioner there, she's right there, she's hands-on, she's able to intervene for the patients, and get things started, and then notify the doctor what's going on. The doctor's always in the loop, but things work that much faster. So that way, if should something happen, I mean, obviously when you're dealing with senior citizens, anything can happen very quickly. And when you're dealing with debilitated senior citizens, as we usually are, things can happen all that much faster. So having Cindy around is a godsend, and the physicians adore her. She's fantastic. She's an excellent clinician. And the patients and their families adore her too, because she's just that good.
Yeah, and all nursing homes should have, but don't necessarily have.
No, they usually have a part-time.
That's equivalent. The nurse practitioner is about equivalent to a physician's assistant, right?
Well, it's really not right.
They have extra training.
Yeah, they do. They have extra training. Physician's assistant, their training is more towards a physician's sort of way of thinking. Nurses think differently. It's the only way to describe it. And when a nurse is looking at a patient, we are always taking a holistic approach. You take a look at the whole patient and see what's going on, and it's from that approach that we treat our patients. And it's not just our residents we know that are involved, it's their loved ones, their families, their friends. There's a lot.
It's a combination.
Yes,
yeah.
it's a whole lot of stuff. And everybody, we include everybody in that.
Well, one of my favorite people was Maddie Forcell. She's on there all the time, and I'm an past EMT and trained, and I often have to drift over there and take care of somebody who needs help. And I must say, she does a nice job over there.
She does a wonderful job.
Fantastic
but
job.
I'm happy to say all the girls.
She's my niece, incidentally.
All the nurses are wonderful, as are the aides. The whole facility. We have a very homey atmosphere at Absolute. We feel that the more comfortable a resident is, whether you're there for short-term rehab or vacation stay, or if you're one of our long-term residents, to keep it as homey and as comfortable and as light and airy as possible, because it should be a fun place, and it is.
Do the wiener dogs still run around?
Oh,
there?
they certainly do.
I went over there. They have two wiener dogs.
Yes.
What do they call them?
Eli and Miss Ruthie. Yes, they're miniature long-haired dachshunds, and they belong to David Reynolds, our administrator, and they generally come with him when he comes in,
and
the residents adore him.
They
adore them too. Yes.
Yep, they love them. Everybody loves them. It's just a wonderful, one of the little positive things. Money. Everybody wants to know what it costs. What's the average patient have to pay? Not if they're on full pay, they pay themselves.
Okay. A private pay patient, the average cost per month is between, I would say, $6,700 to $7,000 a month, and we are the least expensive facility in Chautauqua County. We're about 20% less than any place else within.
So most other places you'd be spending $100,000 a year. There, $7,000 a month, it'd be about $84,000 there.
Between 84 and probably 90, I think.
So it's not cheap. I mean,
No,
it can
it's not
bust
cheap.
you in a matter
Yes,
of
it
months,
can.
you know?
Yes, it can. That is where planning comes into play.
As you pointed out, you can always move your estate to your children long before you need this.
Exactly.
And there's
So
a
many-
reach back period. I think they're reaching back 5 years now.
Yes, the look back period
Yeah.
actually right now is, I think they said August of 2006. And so you really need to pre-plan. So many
Right.
times we've had residents, patients that come in, and there's been no planning because, well, mom and dad look so healthy. Well, yeah, but that heart attack or that stroke that
Bingo.
can suddenly be so debilitating, they're no longer healthy, and suddenly all the plans are going to have to change because of that.
Yeah, the kids aren't going to get bupkis by the time they
Well,
finish.
actually what comes into play is whether or not you have both sets of parents.
Mm-hmm.
If you're one of the sets, either your mother or father, gets sick, then they're only going to take a look at that individual and that individual's income.
Mm-hmm.
Okay, they take a look at the whole picture, but they mostly
Don't they grab
focused.
the assets, though?
No,
They don't, huh?
no. The only time that happens is if you have a widowed parent.
One person with all
One
the
person
money.
with all the money
Right.
or the property. If they have not already given that up to the children or the grandchildren, that's where everything comes into
Poof,
play.
goes poof.
Precisely.
Yeah, okay.
Yes, that's when it happens.
Right, and of course now if they don't have any assets, they can't obviously go in on self-pay. So then they go in on Medicare.
Yes, the
Medicaid.
Medicaid.
Medicare
Well, it
doesn't cover
depends.
much unless you're.
If you're doing rehab.
Yeah, rehab they'll
All right,
cover
if
for
you
a
break
while.
a hip,
Yeah.
if you get pneumonia, congestive heart failure, have a stroke, whatever, and your desire is to do rehab to home, that's where your insurances come in. Your Medicare, your Blue Cross, Univera, Independent Health, whatever you have, that's what helps pay for that rehab. Now, especially Medicare is actually your best bet insurance to have. They pay 100% for the first 20 days, and after 20 days, they cut back to about paying 80%.
Up to how many days? 122?
100 days. Everybody is entitled, if you will, to 100 days of rehab, we'll say per year, just for right
On
now.
Medicare.
Okay, on Medicare,
Medicare, right.
or a Medicare HMO.
Well, yeah, if you're with that.
Right, exactly. What's important is if you have Medicare, just straight Medicare, is to have a secondary insurance. That's where your AARP comes in,
Medigap
or your
insurance,
Medigap,
right.
your Gerber life insurance. There's so many of them out there.
Empire, Blue
yes,
Cross Blue Shield, everybody has them.
Everybody has a secondary. They usually are there to help pay the difference that Medicare doesn't after day 20.
Okay.
And the rule of thumb is, while Medicare will pay, so will they. When Medicare stops paying, they will stop paying. And for Medicare to pay, you must be an active participant in your therapy and be showing some signs of improvement.
Yeah, there's got to be hope you're going to get better.
Exactly.
If you're in a kind of a terminal area, forget it. You don't get it.
That's a different situation, completely.
Couple of calls. Thank you, caller.
Good morning.
Good morning. What's up?
Not too much, except I after the thunderstorm last night, I appreciate the beautiful skies out this morning.
Made the flowers grow, didn't it?
Well, we needed the rain. There's
Yep.
no question. If
Yep.
you're going to have it, middle of the night's a good time.
Okay.
So, anyways, I do have a question.
Sure.
I sometimes have friends that end up for various reasons, sometimes just temporary even, at the nursing home because maybe they've had an operation, they need therapy
Right.
and so forth. Now, at a recent experience, I was in visiting a friend at the nursing home, and she had a problem and had to go to the hospital, and from there they sent her to a different hospital.